Okay, good day nurses. So for today's video lecture, we will discuss your two disorder from your adrenal gland. Okay, and that's your Cushing's and Addison's. And pag pinag-usapan natin si Cushing's and Addison's, guys, I want you to think, guys, the 3S, your SSS. Kasi pag sinabi nating increase SSS, guys, that's your Cushing's. Okay? And pag sinabi nating decrease ang SSS, guys, that's your Addison's. Your SSS, guys, is stands for your sugar, salt, and sex. Okay? Para mas mabilis mong matandaan, nasan ba si decrease dun? Nasan ba si increase dun, guys? Okay? Pag sinabi nating decrease SSS, since nasa word na ni Addison's, guys, kailangan mong mag-add ng SSS kasi decrease si Addison's ng SSS para matandaan mo siya, guys. Okay? So, let's discuss the adrenal gland physiology. Paano ba nangyayari na may release ng SSS and paano kinukulang ng SSS. Okay? So, adrenal hormone regulation, guys, is nangyayari kapag may stress such as from infection, trauma, surgery, and your emotional stress. Okay, so pag may stress kasi nangyari sa katawan mo, guys, the hypothalamus releases CRH or your corticotropin releasing hormone. Now, the CRH, guys, or si hypothalamus, guys, isesend niya yung CRH papunta kay anterior pituitary gland to release now, guys, NACTH or the adrenocorticotropic hormone. And then, until such time, guys, ma-reach niya si adrenal glands, specifically your adrenal cortex. Now, kapag na-reach na si adrenal cortex, guys, it releases now the corticosteroids. Now, si corticosteroids, guys, releases two hormone. That's your glucocorticoids and the mineralocorticoids, also known as aldosterone, and cortisol naman kay glucocorticoid. Now, anong ginagawa ni glucocorticoids? From the word itself, guys, since gluco, sabi niya, it means sugar, right? So, it increases now the blood glucose, but it decreases also the inflammation, but also decreases the immunity. How about naman si mineralocorticoids or si aldosterone, di ba? From our first meeting, sinabi natin na si aldosterone, guys, produces the sodium. So, ini-increase niya ngayon si sodium. So, yung concept, guys, na where sodium goes, water follows, right? So, there is a fluid retention na mangyayari. Now, there is fluid retention. Increase ang fluid sa katawan mo. Pag sinabi natin increase ang fluid, increase ang pressure. That's why increase din ang BP or nag-i-increase ang BP. And also, the concept of PISO, guys, the potassium in, sodium out. So, the sodium and potassium, guys, is inversely proportionate silang dalawa. So, kapag increase ang sodium, guys, then therefore, decrease ang potassium levels from the increased renal potassium excretion. Okay? So, the adrenal glands produces hormones essential for stress and immune response, metabolism, and fluid balance. Your adrenal glands are located on top of the kidneys and consist of two parts from our first meeting, right? That's your medulla and cortex. Now, let's discuss first si medulla. Okay, your medulla, guys, or the adrenal medulla, guys, produces catecholamines, di ba? And si catecholamines, guys, such as your epinephrine and norepinephrine, guys, they are responsible or sila yung nag-a-activate sa fight or flight response natin or ang tinatawag natin na nag-i-increase ang sympathetic response. So, as a result, guys, it increases the BP, heart rate, and blood glucose. How about naman si cortex, guys? Okay, si middle pala, guys, saan siya nakikita? From our first meeting, since immune, guys, di ba sinabi natin from the middle. How about si cortex, guys? It is found outside, di ba? Since parpasi siya. Okay? And it produces, guys, your cortex produces androgens and corticosteroids such as the cortisol and aldosterone. Okay? So, your cortisol, guys, anong ginagawa niya? Sinabi natin kanina, it decreases inflammation and decreases also the immunity and increases your blood glucose. How about si aldosterone, guys? Diba, from our first meeting, sinabi natin si aldosterone, guys, produces the sodium. So, kapag mataas ang sodium, guys, nagpa-follow si water. Now, there is a fluid retention na nangyayari. So, increase ang fluid sa katawan mo, then therefore, increase ang pressure. And, since inversely proportional sila ni potassium, guys, from the concept of piso, the piso inside, sodium outside. Okay, so, pag increase si sodium, decrease si potassium from increased renal excretion. Okay, so the corticosteroid secretion is regulated by a negative feedback loop. Okay, paano naman yun, guys? Okay, for example, guys, si corticosteroid is masyado nang mataas, guys, ang release. Yung hypothalamus mo, guys, is nasa-sense niya yan, guys. Now, ang gagawin ni sa hypothalamus mo, guys, is magsasend siya na kay anterior pituitary gland na i-stop na ang pag-produce ng ACTH para ma-stop na ni adrenal glands ang pag-produce ng corticosteroids. That's your negative feedback loop na tinatawag. Okay, so your adrenal cortex disorders, guys, are your Addison disease from corticosteroid deficiency. Sinabi natin kanina, guys, na decrease ang SSS, and si Cushing and Cone syndromes naman, guys, from corticosteroid excess, siya yung mataas ang SSS. Okay, so let's compare, guys, the Addison's and your Cushing syndrome. Okay, in terms of fluid balance, guys, since Addison's disease, sinabi natin, kulang siya ng SSS, right? So, decrease ang sodium and fluid volume since walang mag-hold, since walang sodium, walang mag-hold ng water. As a result, guys, decrease ang BP. And since decrease ang fluid volume, guys, si patient natin ngayon ay magwe-weight loss. Okay? How about kay Cushing syndrome naman, guys, in terms of fluid balance? Since mataas ang SSS mo dyan, guys, increase ang iyong sodium. Now, increase ang sodium, then therefore, the water follows. Right? So, there is a water retention na mangyayari. As a result, guys, since mataas ang fluid, ano yung sinabi natin? Mataas din ang pressure. That's why nag-i-increase ang BP. And of course, guys, there is a increase in fluid volume, guys. Magkakaroon ngayon ng weight gain. How about in terms of glucose and potassium? Since si Addison's mababa ang SSS niya, guys, then therefore decrease ang glucose and increase ang potassium, guys, kasi nga inversely proportional siya kay sodium from the concept of piso. How about naman kay Cushing syndrome? Okay? Since mataas ang sodium kay Cushing syndrome, guys, decrease ang potassium. And since mataas ang SSS kay Cushing syndrome, guys, ibig sabihin mataas ang sugar. How about treatment now, guys, kay Addison? Since, di ba sinabi natin, kulang si Addison's ng SSS, guys, meaning kulang siya ng corticosteroid release. So, kailangan nating i-replace yun, guys. So, corticosteroid replacement para kay Addison's. How about kay Cushing syndrome, guys, na sobra naman ang SSS, meaning sobra ang corticosteroid release. So, i-discontinue natin ang chronic use of steroid and surgery na, guys, if the cause is tumor. Okay, from tumor. So now, let's discuss further your Addison's disease or the adrenocortical insufficiency. Okay, your adrenocortical insufficiency, guys. Ano nangyayari yun? Ano nangyayari dun, guys? There is a corticosteroid deficiency due to primary your Addison disease or secondary causes decreases the ACTH. Yung sinabi na naman natin na leveling, guys. Okay. Si primary, guys, the problem is the adrenal glands. That's your Addison's disease. Si secondary naman, guys, is from your anterior pituitary gland. Decrease daw ang release ng ACTH. Okay? So, si Addison disease, guys, is a autoimmune disorder or from malignant or tumor adrenal destruction, thus decreasing, guys, the cortisol plus decrease also the aldosterone. As a result, guys, there is a impaired fluid, electrolyte, and glucose regulation. Okay, so now you understand, guys, the pathophysiology and anatomy of your Addison's disease. Let's discuss, guys, kung ano yung makikita natin ngayon, ano yung magmamanifest natin since you understand na mababa ang SSS. Okay? So, decrease ang aldosterone. Sabi natin kay Addison's, right? So, there is a sodium and water loss. Mababa ang sodium. And since mababa ang sodium, walang mag-hold dun sa water, right? So, magkakaroon ng water loss plus potassium retention. Kasi nga, inversely proportional si sodium and potassium. So, as a result, guys, since mababa ang sodium, guys, and walang water retention na nangyayari, guys, hypotension ang makikita natin kay patient. And since mababa ang sodium, of course, hyponatremia and fluid deficit. And since may potassium retention, guys, hyperkalemia ang makikita natin sa labs ni patient. How about decrease cortisol naman, guys? Kapag decrease ang cortisol, guys, magkakaroon ngayon ng decrease in your sympathetic nervous system or the fight or flight response na tinatawag natin. And also, guys, kay Addison's, decrease din ang sugar, right? So, hypoglycemia. And as a result, guys, anong makikita natin? Since mababa ang sodium, guys, fatigue si patient and may muscle weakness siya. And since mababa ang sodium, there is a water loss also, right? So, weight loss ang makikita natin kay patient. And this is the pathognomonic sign of your Addison's, guys. The bronze skin from increased melanin production. Okay? So, pag-usapan pa natin siya, diba? Sabi natin kanina kay Addison's disease, guys, since kulang siya ng SSS, so decrease ang sodium. And pag decrease ang sodium, increase ang potassium because they are inversely proportionate. And since decrease ang sodium, walang mga hatak ng fluid. And since walang fluid, decrease ang pressure. That's why decrease ang blood pressure. And since sabi natin kay Addison's, guys, mababa ang SSS, specifically the sugar. That's why hypoglycemic si patient. And the pathognomonic sign of your Addison's disease, guys, is the bronze skin. And lastly, guys, ano pang makikita natin? Since decrease ang sodium, walang retention na nangyayari. And there is fluid loss na nangyayari. So, weight loss ang makikita natin kay Addison's. Okay, so now, what is your interventions, guys? Now, na alam mo na kung ano yung magmamanifest na signs and symptoms ni patient or ano yung mafe-feel niya. So, we address now, guys, kung ano yung mga na-experience ni patient. Okay, your Addison's disease, guys, focuses on increasing corticosteroid level since kulang nga siya ng pag-release ng corticosteroid, right? And managing the electrolyte, glucose, and fluid balance. So, yan lang yung focus natin kay Addison's, guys. Okay, first, let's discuss the increased corticosteroid levels. Paano ba natin siya papataasin, guys? Okay, in primary adrenal insufficiency or your Addison's disease, guys, it requires lifelong corticosteroid replacement. Okay, to prevent, guys, hypotension, hypoglycemia, and hyperkalemia. Kung ano yung nangyayari kay Addison's para ma-prevent yun. So, we need corticosteroid replacement and that is lifelong, guys. Then, administer corticosteroid as prescribed. So, such as it ends with your son, the hydrocortisone and the prednisone. And, you need to increase steroid dose, guys, pag may stress or illness na na-experience si patient to prevent Addisonian crisis, the acute adrenal insufficiency, which is life-threatening state of shock, hypoglycemia, and hyperkalemia. Okay, so you need to address that one, guys. Kapag may stress na experience si patient or illness, guys, you need to increase the steroid dose to prevent the Addisonian crisis. Then teach clients at risk for Addisonian crisis to wear medical alert bracelet so that, guys, yung mga kasama ni patient or yung makakakita kay patient is aware sila na meron siyang Addison. Okay? Then report signs of infection, guys, such as fever promptly. Kasi nga, kapag may signs of infection si patient, guys, kailangan mong i-increase ang steroid dose niya to prevent the Addisonian crisis. Then, avoid triggers for Addisonian crisis such as strenuous exercise and stress. Okay, so let's discuss your corticosteroids, guys. Diba, this is the medication, guys, na kailangan kay Addisonian disease. Okay, your corticosteroids, guys, such as it ends with son, your prednisone, methylprednisolone, dexamethasone, and hydrocortisone. Okay, for corticosteroids, remember, guys, your nursing consideration, remember, the mnemonics is stop. Okay? stop. Okay? S, guys, for sugar. Okay? So, you need to monitor blood sugar, especially if client has diabetes. And T, guys, for taper. Taper is slowly to prevent adrenal insufficiency. So, do not stop abruptly. Okay? Then, O, guys, stands for your osteoporosis. So, you need to encourage, guys, weight-bearing exercises and a diet high in calcium and vitamin D. And lastly, guys, the P stands for prevent infection. Diba, we all know naman, guys, when we are taking corticosteroids, bumababa ang ating immune system. So, we need to teach the patient to prevent infection, guys. So, paano, guys? Teach client proper hand hygiene and to avoid crowded places. Kasi nga, ang iniiwasan din na natin na isa is the Addisonian crisis. Okay? And number 2, we manage electrolyte, glucose, and fluid balance. Since Addisonian disease, guys, or the Addison's disease is at risk for fluid deficit, hyponatremia, hyperkalemia, and hypoglycemia. So, you need to implement, guys, cardiac monitoring to assess for these arrhythmias from hyperkalemia na nangyayari kay patient. So, paano ma-identify, guys, na may hyperkalemia na si patient? Kapag doon sa ECG niya, guys, you observe peak T waves. That indicates kasi, guys, hyperkalemia. And para mas mabilis mo siyang matandaan, guys, isulat mo si hyperkalemia ng hyperthalemia. Okay? So that para matandaan mo, guys, na si hyperkalemia is si peak T waves. Then, increase sodium intake to prevent hyponatremia. O ano yung mga rich in sodium natin na mga food, guys, such as your canned goods. Right? Then, monitor BP for hypotension. Then, measure daily weights to assess for weight loss and monitor intake and output. This is your hyperkalemia and hypokalemia. Diba sabi ko, si hyperkalemia, isulat mo siya ng hyperthalemia so that you remember, guys, na ang ma-observe mo dun sa ECG, pag hyperkalemia ang patient, ang na-experience si patient is the peak T wave. How about hypokalemia naman, guys? Pag hypokalemia, isulat mo siya ng hypokalemia so that you remember, guys, na prominent U wave ang makikita mo in terms of hypokalemia. Okay, now let's discuss your Addisonian crisis. Okay, so paano ba nangyayari or paano nagkakaroon ng Addisonian crisis, guys? From abrupt corticosteroid discontinuation. That's why, guys, you need to taper. Diba sinabi natin kanina? And when we say taper, guys, unti-unti mo dapat dinidecrease ang dosage. Yun yung ibig sabihin ng taper, guys. Then, from increase, and also, guys, you need to increase cortisol demand pag may Addisonian crisis na nangyayari from illness, strenuous activity. So, ano yung findings, guys, na makikita mo kay Addisonian crisis? So, hypotension, hypoglycemia, that cause, guys, confusion na. So, crisis na ang nangyayari. And hyperkalemia, guys, pag nakaka-experience na ng abdominal pain, vomiting, and diarrhea si patient. So, what is the treatment, guys, kapag Addisonian crisis ang nangyari? Your number 1 priority, guys, is to administer IV corticosteroid. So, IV na siya, guys, ha? IV na siya para mabilis na yung absorption, okay? So, you need to monitor frequently the blood pressure and blood glucose of the patient. Then, administer IV fluids to correct the hyponatremia na nangyayari and hypotension. Right? And administer IV glucose for hypoglycemia na nangyayari. And lastly, guys, you need to administer IV 50% dextrose and insulin for hyperkalemia. Now, guys, you ask, bakit mag-a-administer tayo ng insulin? May hypoglycemia na si patient. Okay, ganito kasi yan, guys. Paano nangyayari? For example, guys, this is your blood vessel, right? Then, sa tabi ng blood vessel mo, guys, nandyan yung mga cells mo, right? Nandyan yung mga cells mo. So, sabi niya kay Addisonian crisis, guys, increase ang iyong potassium, right? Increase ang potassium. You have hyperkalemia. Pero, hypoglycemic ka. So, decrease ang glucose. Sabi niya, you need to administer insulin. So, this is your insulin. Ano bang ginagawa ni insulin, guys? Pinapababa niya yung sugar level. Bakit tayo magbibigay? May hypoglycemia na. Ano ang ginagawa ng insulin, guys? Ang ginagawa kasi ng insulin, guys, is to address the hyperkalemia. Okay? So, si insulin kasi, guys, is magiging parang sasakyan siya ni potassium guys, para yung mga potassium guys is matransport papunta sa cells mo. Okay? Addressing now the hyperkalemia guys, or para ma-resolve si hyperkalemia. Si insulin guys magse-serve as transportation ni potassium papunta sa cell para ma-address si hyperkalemia. O now, syempre, alam nating lahat na si insulin, hindi lang potassium ang tinatransport niya, right? Isasama niya rin ngayon si glucose. So, na ipunta doon sa cell mo para magamit ng katawan mo, right? So, may hypoglycemia na siya. That's why, guys, you need to administer IV 50% of dextrose, guys, because this 50% dextrose, guys, contains sugar. So, ngayon, na-address mo yung hypoglycemia and hyperkalemia ni patient. Okay? By administering IV 50% dextrose and insulin. And that is all for your Addison's disease. Okay, now guys, we move on to your Cushing syndrome or the hypercortisolism na nangyayari naman. Okay, so sabi natin kay Cushing syndrome guys is there is an increase in your SSS. Right guys, the sugar, salt, and sex. Okay, paano ba siya nangyayari guys na there is increase in your SSS? Because kay Cushing syndrome guys, there is an excess cortisol and aldosterone na nare-release, and it is caused by your adrenal or pituitary gland tumors or long-term corticosteroid use. O sino ba yung mga patient na gumagamit ng corticosteroids guys, or yung chronic na gumagamit ng corticosteroids? That's your mga patient na may COPD and rheumatoid arthritis. Okay? And from adrenal guys, meaning it is primary, and si pituitary gland tumors naman guys, meaning it is secondary. Okay, now what are the assessment findings na makikita natin? Because there is a increase in your aldosterone guys. So, sabi natin kanina, the aldosterone guys releases sodium, right? So, pag increase ang aldosterone, therefore increase ang sodium. As a result now guys, na may mag-hold ng water because of the concept na where sodium goes, water follows. So, there is a water retention plus potassium loss because of the concept guys nung piso, 'di ba? The potassium in, sodium outside. So the potassium and sodium guys is inversely proportionate. Okay? So since increase ang sodium guys and there is water retention, there will be hypertension or hypertensive si patient natin. And since increase ang sodium guys, so hypernatremic ang patient natin and fluid overload. Okay? And since there is a potassium loss na nangyayari guys, of course, hypokalemia or hypokalemic si patient sa ECG niya. Okay? O what else guys? Because of the increased cortisol guys, nag-i-increase ang SNS activity or the sympathetic nervous system activity or what we call fight or flight response. And since sabi natin na kay Cushing syndrome guys, increase ang SSS, the salt, sugar, and sex, o specifically the sugar guys, then therefore hyperglycemic si patient natin na may Cushing syndrome. O what else guys ang ma-observe natin? Truncal obesity, moon face, and buffalo hump. And because of the increased cortisol guys, nabre-breakdown yung collagen ni patient, as a result guys, na may thin skin and may poor wound healing si patient. Okay, so i-compare na natin ngayon yung dalawa guys, the Addison's and your Cushing, para mas mabilis nyo na siyang ma-memorize and matandaan. Diba sabi natin si Addison's guys, decrease ang yung SSS. So, decrease ang salt, therefore decrease ang sodium, and inversely proportional siya kay potassium. That's why kay Addison's guys, increase ang potassium. And since decrease ang iyong sodium guys, then therefore walang mga hatak ng water, right? So there is water loss or weight loss na mangyayari. And since there is water loss, then therefore guys, decrease din ang pressure. So decrease ang BP. And since sabi natin kay Addison's na decrease ang iyong SSS, specifically the sugar guys, kaya si patient natin ay hypoglycemic. And the pathognomonic sign of your Addison guys is the bronze skin. How about kay Cushing naman guys? Kay Cushing disease, sabi natin guys na increase ang kanyang SSS. So, ano yung makikita natin guys? Of course, increase ang kanyang sodium and inversely proportional siya kay potassium. That's why kay Cushing disease guys, decrease ang iyong potassium. And since increase ang sodium guys, ang sabi natin kanina, where sodium goes, water follows. So, merong water retention na nangyayari. As a result, guys, mataas din ang pressure. So, increase ang BP. And since there is water retention na nangyayari, as a result, guys, weight gain ang nangyayari kay patient. O what else, guys? Ang makikita natin, moon face, buffalo hump, and thin and fragile skin because of the increased cortisol, guys. 'Di ba sabi natin kanina, pag increase ang cortisol, guys, na-break yung collagen. That's why, guys, nagkakaroon ng thin and fragile skin si patient natin. Okay, balik tayo kay Cushing syndrome, guys. Okay, what is the complications naman ni Cushing syndrome, guys? Okay, clients with increased corticosteroids levels, guys, are at risk for fluid overload from water and sodium retention, and at risk for infection, guys, because cortisol suppresses the immunity. Diba tumataas kasi ang cortisol, right, guys? And at risk for injury from thinning, poor wound healing, and osteoporosis. So there is a fracture risk kay Cushing syndrome. Okay, now, what are the nursing interventions, guys, na kailangan mong gawin na we understand kung ano yung nangyayari kay patient and ano yung pathophysiology behind the Cushing syndrome. Okay, so your care, guys, or your nursing care focuses on 3. Okay, first is to decrease corticosteroid levels. Then, second, guys, is to manage the electrolyte, glucose, and fluid balance na nangyayari. Okay? Or the fluid imbalance na nangyayari. Then lastly, guys, by preventing injury and infection. Okay, so let's discuss it one by one, guys. Okay? So first is to decrease corticosteroids level. So paano natin gagawin yun, guys? If long-term corticosteroid use is the cause. Okay? So kapag long-term corticosteroid ang cause, guys, you discontinue corticosteroids medication. Okay? By gradually taper the client of corticosteroids to prevent naman now, guys, the acute adrenal insufficiency, the Addisonian crisis na sinabi natin kanina. Okay? So, you gradually taper, guys. Ha? When we say gradually taper, unti-untiin nating bawasan yung dosage. Okay? Then, administer adrenal suppressing medications like your ketoconazole or mitotane, which decreases the cortisol production. So, isusuppress mo yung adrenal gland, guys, para mag-decrease ang cortisol production. Okay? So, if a tumor naman, guys, is the cause, you anticipate chemotherapy or tumor removal from hypophyseectomy and adrenalectomy. Adrenalectomy ang gagawin mo, guys, kapag primary. Okay? And hypophyseectomy ang gagawin mo, guys, if the cause is secondary. So, depending on the location of that tumor, guys, ang gagawin mong surgery. Okay? Kasi si hypophyseectomy, that's your removal of the pituitary gland, right? Your adrenalectomy, that's the surgical removal of your adrenal gland naman. Okay, so what is the adrenalectomy considerations naman, guys? Okay, so si adrenalectomy, guys, is the surgical removal of your adrenal gland. Sinabi natin kanina. Okay, so kapag nag-adrenalectomy ka kasi, guys, there is a increased risk of bleeding. Why, guys? Because highly vascular yung adrenal glands mo, guys. And increased risk of fluid and electrolyte imbalances. Why, guys? Because gland manipulation during surgery, guys, stimulates the hormone release. Diba? Yung concept, guys, pag tumor ang pinag-uusapan, pag ginalaw mo ang tumor, there is hypersecretion na nangyayari. So, what is your nursing interventions, guys, kapag nag-adrenalectomy? So, after adrenalectomy, guys, monitor clients for acute adrenal insufficiency or yung tinatawag natin na Addisonian crisis. Kasi, ni-remove mo yung, imagine, guys, you remove your adrenal gland, then therefore, wala nang release ng corticosteroid. So, as a result, guys, bababa ang SSS. So, you need to monitor guys for signs of symptoms ng Addisonian crisis pag nag-adrenalectomy. Okay? Such as shock, hypoglycemia, and hyperkalemia. Diba? These are your signs and symptoms of Addisonian or Addison's disease or Addisonian crisis. Oh, what else guys? Of course, kailangan mo ng lifelong corticosteroid replacement. Why? Kasi nga, ni-remove mo na yung adrenal ni patient. Resulting now guys na wala nang magre-release ng corticosteroids. That's why you need lifelong corticosteroid replacement. Specifically guys, kapag ang ginawang surgery is the bilateral adrenalectomy. Meaning, tinanggal niya na lahat ng adrenal glands mo. Okay? So next, intervention, we manage now the electrolyte, glucose, and fluid imbalance na nangyayari kay patient. Okay? So, ang patient kasi guys na may Cushing syndrome guys, at risk sila for fluid overload, hypernatremia, hypokalemia, and hyperglycemia. Kasi nga, uulitin na naman natin, mataas ang iyong SSS, the sugar, salt, and sex. Okay, so you need to implement guys cardiac monitoring to assess for these arrhythmias and from hypokalemia. Okay, ano naman ang makikita mo kapag hypokalemic si patient? Okay, that's your flat or inverted T waves. That's indicate kasi guys na nagha-hypokalemia si patient from the ECG. Diba sabi natin kanina guys, pag hyperkalemia, ang ma-observe mo, it's the peak T wave. When we say hypokalemia naman guys, it's the prominent U wave or the flat T wave or inverted T wave. Diba sabi ko, para mas mabilis siyang matandaan, si hypokalemia, i-change nyo yung letter O into U so that you remember guys na ang makikita mo, it's the prominent U wave. Kay hyperkalemia naman guys, I want you to change the letter K into T so that you remember guys na pag hyperkalemic si patient, ang makikita mo, it's the peak T wave. Okay? Hopefully, na-gets yun, guys. Oh. What else, guys? You need to monitor BP due to risk of hypertension kasi nga mataas ang salt. Okay? Then, limit sodium intake to prevent fluid overload kasi nga mataas na ang salt. Then, assess for fluid volume overload. Since mataas ang sodium, there is a water retention kasi na nangyayari, guys. Diba? Kasi where sodium goes, water follows. So, increase at risk kasi si patient for acute, rapid, life-threatening pulmonary edema. That's why you need to assess for fluid volume overload. O what else guys? You need to monitor for bounding pulse, crackles, and edema since there is fluid volume overload because of the increased sodium. Diba? And measure daily weights to assess for weight gain. O paano na naman yan guys? Same time, same clothes, and same scale. Okay? O what else? Number 3, intervention guys, or last intervention for your Cushing syndrome guys is to prevent injury and infection. So you need to teach your patient guys for fall prevention methods to prevent fractures. O ano yung mga kailangan mong i-advise sa kanya guys? Kailangan doon sa bathroom nila guys, there is a, what do you call this? Bar or grab bar, di ba? Doon sa bathroom ni patient or sa bathroom ng patient natin guys, there is a grab bar. And also guys, yung mga rigs or rugs natin guys is dapat tanggalin, right? So you need to instruct that to your patient. O what else guys? Kailangan yung side rails ni patient guys is nakataas. O yun yung mga fall prevention natin guys. And you need to provide teaching to prevent infection. O paano na naman guys? Practice frequent hand hygiene. Okay, then you instruct the patient to receive flu vaccine annually and avoid crowded places and closely monitor for skin breakdown due to edema and thin skin. So you need to implement measures guys to prevent skin breakdown such as you need to pad the bony prominences, meaning guys, yung bony prominences, yan yung nalalagyan ng pressure pag nakahiga si patient. So, you need to put a pad there guys. Then, pressure support mattress. And that's all for your Cushing's disease. Now, we move on naman guys sa disorder ngayon ng adrenal medulla. Kanina, diniscuss natin si Addison's and your Cushing. That's your disease of your adrenal cortex. Now, we discuss the disease naman kay adrenal medulla and that's your Pheochromocytoma. Okay? Your Pheochromocytoma is a rare adrenal medulla tumor causing increase in catecholamine release. Okay? Your epinephrine and norepinephrine or what we call the flight or fight response. Okay? So, if there is an increase in catecholamine release, then therefore may increase din in your epinephrine and norepinephrine. As a result guys, nag-i-increase ang iyong SNS activity. So, there will be a rapid, severe increase in BP, HR. So, at risk ka ngayon for hypertensive crisis. O what are the assessment findings guys na makikita natin? There is a severe hypertension. Meaning guys, the systolic pressure is greater than or above na guys, 160 to 180. Okay? O what else guys? Palpitations and tachycardia. Okay? O what are your nursing interventions guys kay pheochromocytoma? You need to closely monitor the BP kasi nga tumataas ng BP. Actually, severe ang nangyayari. Pwede ring umabot ng 200 to 220 ang systolic blood pressure ni patient. Then, do not palpate the abdomen guys. Kasi when you palpate the abdomen guys, possible na matrigger mo si adrenal medulla. As a result guys, or the tumor in your adrenal medulla. As a result guys, there will be hypersecretion na mangyayari. So, mag-i-increase ang catecholamine as a result ng pag-increase din ng epinephrine and norepinephrine. So, mas natitrigger ang SNS activity. So, mas nag-i-increase ang BP and HR, mga ganyan. Okay? So, ayun, the direct pressure on the tumor guys increases the catecholamine release, now increasing the BP. So, you need to administer beta blockers now guys to block the effects of catecholamines and decrease BP. O ano yung mga beta blockers nyo guys? That's your ends with LOL. And you need to anticipate guys adrenalectomy to remove the tumor guys. And that's your disease in adrenal cortex and adrenal medulla. Thank you and God bless.